Hi, it's Dr. Dumestri, board certified plastic surgeon. I had a big week of labiaplasties, which inspired me to do a mini series on the topic. Starting with what is a labiaplasty? So when we're talking about vulvar rejuvenation, so rejuvenation of the whole genital area in vulva owners, I'm talking about the outer lips, the inner lips, the reshaping of the clitoral hood, and the area that's kind of right behind the vagina that can sometimes have some that crinkly skin. So there's a few different components to consider. There is the labia majora, which are the outer lips, and when people come to see me for that, it's often for deflation. So over time, the tissue becomes thinner, some of that fat atrophies, becomes thinner, and those outer lips are a bit deflated, not kind of that plumpness, and people like them a bit plumper, both for the look and for function, to keep everything closed. Now, that is done through fat grafting, where you do low volume liposuction of one body area, harvest a little bit of fat, you don't need very much, and inject it. Now, the more common reason that people come to see me for labiaplasty is for an inner lip trim. So they don't like the feel or the appearance of the inner labia that are dangling longer beyond the outer labia. So that's when you're standing, you can see that hang that comes in between the outer labia. Now, labiaplasty of the labia minora is something that's done. My personal technique is a trim technique that then goes up into the clitoral hood to address any looseness there, and then down to the posterior fourchette to address any skin bunching there. I'll go more into the technique in another video. And then there's the internal rejuvenation. So anything surgical in the vagina is typically gynecological surgery, not something that I typically offer. But then we have non-operative ways of rejuvenating that area. So that could be through the Diva laser, which is an internal probe, goes in, enhances blood flow, rejuvenates the inner lining, enhances lubrication, enhances pleasure. And then there are the PRP injections, also known as the O-shot, which are injections into the G-spot area internally, and it can also be around the clitoris, which also function to enhance blood flow to the area, enhance pleasure. So 3 different components, non-operative stuff, very common, the labia minora trim, very common, the atrophy, for whatever reason, I just don't see as many women seeking that, but definitely a thing too. Have a great day.